Okay, this is going to be a demonstration on how to find the ventrogluteal muscle, which is the largest muscle we give IM injections in. First thing you're going to remember is to have your patient laying down. Do not ever give one of these injections with a patient standing or sitting. So have them lay down. It's going to be much easier to find your location. The first thing you're going to want to do is use the heel of your hand to find the greater trochanter. The greater trochanter is the top of the femur, and it's right there in the hip joint. So you can feel when you rub over, you can find that. If you have a patient you're having a hard time locating, you can have your patient bend their leg, and you can see right here the crease. That's where the hip joint is, and that's where that greater trochanter is. So you'll use the heel of your hand to find that greater trochanter, and then you'll take your fingers and feel up for the iliac crest, which is right here at the top of the hip bone. If you have a patient that you have a hard time feeling that bone, you can ask them to put their hand on their waist, and they will almost always put it right there in the location it needs to be. So I've got my fingers on the iliac crest. My thumb is facing the groin, so that's how I know I'm using the correct hand. And then I'm gonna take my pointer finger and I'm gonna drag it around and feel for the iliac spine, which is where that hip bone jets out. Now that I've got my hands like this, I'm gonna give that right here in the center of that V. An easy way to help make sure you mark that location is you can take your syringe with the cap on and use that to make a mark. And when you pull your hand away, it'll leave a small indentation that does not hurt the patient. That way you can clean your site and then give your injection. Again, with an IM injection, we're going in at a 90-degree angle, so you'll go straight in and insert the entire needle, give your medication, and pull it out. Okay, this is going to be a demonstration on how to find the vastus lateralis. So the vastus lateralis is another location we can give IM or intramuscular injections. This is a very common location to give injections to babies and toddlers. The way you're going to want to find this location is you've got two landmarks. I'm going to look for that greater trochanter, which again is right here at the hip. I'm going to put my hand just like this, and then I'm going to go to the patella or the knee, and I'm going to have my hands on football goals, bring it in. I'm going to join my two fingers to make a triangle, and I'm giving my injection right here. The vastus lateralis is the top side of the thigh. So here's the top, here's the side. My injection is going to go here. This is an IM injection. Remember, you'll go in at a 90-degree angle, insert the needle all the way, inject your medicine, and pull it all the way out. All right, so this is going to be a demonstration on how to find the deltoid muscle. Deltoid is a very common location to give IM or intramuscular injections on patients 3 and above. The way to find this, first make sure you have your patient sitting. Again, we never give injections with a patient standing. So you have your patient sit, and we're gonna lift up their sleeve, and the landmark you're gonna look for is the acromion process, which is the joint here on the shoulder. You can feel the dip down, or you can have your patient lift their arm up and you can feel where that joint is. So I'm gonna use my hand, find that acromion process, and then for an adult, I'm gonna go 3 fingers down, and I'm going to give my injection right underneath that. And again, you can use the cap of the needle to make a spot, so then you can clean and still find your location. If I'm giving an injection to a child, again, I'm gonna find that acromion process, and I'm gonna go 2 fingers down, and I will give my injection there. Again, this is a intramuscular injection, so I'm gonna go in at a 90-degree angle, insert all the way, inject the medication, and you'll pull it out.